we're here, and we're here tonight also again for a very important issue, and something that I think it's important for all of us. And we want, again, to help you connect your dots, not my dots, not Canelli's dots, your dots. What does it tick for you? What does it do to you? What does it say to you? And you need to really listen to your body. And I think the topic today is very interesting. Would you like to introduce, Canelli, our topic? Because it's really out there for everyone.
Yeah, the insulin resistance, I must say, it took me a while to get it for my own self. I was walking around with a lot of insulin resistance. And I'd love you to speak into that, Dr. Sabine, for women, because we always change. We go into different stages of life. So for me, it happened after I birthed my girls, and who knows, maybe put on a couple of kilos, or I had kilos it's just one of those things, right?
Yeah.
It got so bad that I couldn't understand. I took a flight to New York, and then I went, actually, there was like a birthing seminar that I was attending. And I remember after that, my body was telling me, I'm hungry, I'm hungry, I'm hungry. And I would go and get like smoothies, and I would have the smoothies. And then the next morning I woke up and my body was saying, I'm hungry, I'm hungry. And I would eat breakfast. And then I would go, I'd have like something at my Airbnb, I would have it. And then afterwards, I would go to a restaurant, still breakfast. My seminar only started at 9 o'clock in the morning. I'd already eaten, I had like yogurt and fruit at the house. And then I had like another matcha latte and a toast with salmon and avocado. And by the time I got to the conference at 9 o'clock in the morning, I couldn't go in because I was hungry. So I went and found a banana and almonds. And still after that, I got into the conference, and about an hour later, they gave us a break, and I went and ate. And I said, there's something not right here. My body couldn't understand. It couldn't switch off the hunger. And then immense thirst. I remember after a swim race, my body was thirsty for like a whole day afterwards. So and then you pointed out on one of my, you saw my 110 blood sugar, and you were like, oh, that's fasting is not good. So that was joining the dots that I just never saw it. And so this is what we're going to do today, is we're going to shine some light, because these symptoms are, everybody speaks about, oh yeah, I'm hypoglycemic, or if I don't eat, I get a migraine. And we hear a lot of that commentary. So we're going to talk about all of that today.
Yeah, I mean, let's start. Let's just identify what insulin is. Let's just see where it comes from. Let's just, put a name to it. And again, I would say it's a silent epidemic. We don't want to bore you, but, this whole concept of the hormonal imbalance is just so complex, and it really is so multifaceted and has so many different dressings that you really don't know where to start from. And I think insulin resistance is really a big one, because it kind of sneaks in. It's nothing loud and super painful and, oh, I need to think that way. It kind of sneaks up on you, over the years. And you consider things normal that they are not normal, and you consider the extra kilos, it's okay because of y x y z, but it's like a silent epidemic that sneaks up on you, and it definitely opens the door to serious diseases. And that's why we're here to identify a little bit the ABCs, and then connect the dots, and let's see what we can do about it, and where can we be proactive in order to take action before it actually becomes a problem. So let's just go right into it. So the pancreas, as you all know, ladies, is one of the endocrine organs. Endocrine organs means that it's an organ that produces hormones. So the pancreas is one of them, and it's situated, as you can see, it's about 6 inches long, and it sits across the back of the abdomen behind the stomach, and the head of the pancreas on the right side of the abdomen, is connected to the duodenum, which is the small intestine. So that's where the first part of the gut from the stomach goes into the small intestine. Um, and it's connected through a small tube called the pancreatic duct. So this pancreatic duct is the narrow end of the pancreas, and it's called the narrow part of the pancreas called the tail, and it extends to the left side of the body. So we have the head of the pancreas with the pancreatic duct ending into the small intestine, and the tail to the left side of the body, all nicely kind of snuggled under the liver and between the gallbladder and the liver and the small intestine. So endocrine organ, the pancreas, and it's the mother of insulin. That's where insulin gets born and where insulin gets produced. So just to have an idea of where it comes from, and we want to see the next slide. You put my glasses, of course, then my hair is again horrible, but what can we do? How does insulin work? The insulin gene produces the polypeptide hormone insulin, which is required, for the normal glucose homeostasis, so it's the regulation of the blood sugar levels. So insulin is extremely important for for the regulation of the blood sugar. The lack of insulin or insulin insufficiency can lead to diabetes mellitus, which is blood sugar disease, which affects up to 5% of the human population, and that is really on the rise. So this is really something that goes, up and up every year. We do really see the insufficiency of insulin, which we're going to talk a little bit later. So you can see here, how the insulin is really the key to locking onto the cell. So it goes onto the insulin receptor. Just remember, ladies, that it's always a question of the hormone locking onto the receptor. We have this with estrogen, we have this with thyroid, we have this with all the hormones. So you have the insulin locking onto the insulin receptor, and that allows then the glucose channel to open and allows the glucose to enter the cell. And that is the process where, the body creates energy and, gets converted into ATP, which then is the food for the mitochondria and the whole cell metabolism. We don't want to make it too complicated, but just be aware, insulin locks onto the insulin receptor, and then glucose channel opens. It only opens when the insulin, locks onto the receptor. This is very important. So insulin is the key that unlocks the glucose channel, and the glucose can only get into the cell when the glucose channel is open. So without insulin, glucose cannot get into the cell and stays outside in the bloodstream, and we'll see the result of that down the road. So again, how does the insulin work? Is the receptor that it locks on, the glucose channel opens. Just a little bit simpler slide for you to understand. It's basically really like a key, click, and the moment you turn the key, which means that the insulin has locked onto the receptor, the glucose channel opens and the glucose enters the cell. So it's really very, very magic if you think about it. I mean, that's why I'm also always so intrigued by it, because it's such a fine tuning and such a fine, delicate, really balance that there's there. So, there's so many receptors and so many insulin. So you need to understand that we need the insulin receptor connection in order for the glucose channel to open, so that the cell gets the fuel in order to work, because that's what it is. The glucose gets transported into the cell in order to become, the energy generator for cell metabolism. That's the work of insulin. So, I mean, this is just, to really see a little bit, with this kind of more complicated slide, which really shows, the beta cells of the pancreas, they are stimulated to release the insulin into the blood. The insulin then gets taken up by the liver and stores it as glycogen. The body cells take up more glucose. The blood glucose level, they go down. So because the glucose goes into the cells, the level in the periphery goes low. And this is the stimulus for the insulin release to be diminished, because, you know, the homeostasis is this, 90 milligrams per 100 milliliters, which is the ideal. So if the receptors are measuring, that the that the blood sugar is low in the periphery, then you get the release of the stimulus for the insulin release to diminish. Removal of excess glucose from blood and low blood glucose levels when they're measured. So as you remember from all the hormones, we always have this constant feedback. We always have this constant, amazing feedback of at what position in that case is the blood glucose. So you have immediate feedback onto the beta cells of the pancreas that the blood sugar is low enough, and the stimulus to produce from the beta cells of the pancreas goes down, less insulin is released, and then the same happens to the alpha cells. So we have the beta cells of the pancreas, and we have the alpha cells of the pancreas that they then stimulate to release glucagon into the blood. And the glucagon is, gets into the small intestine through the hepatic portal vein, and the liver breaks down glucagon and releases the glucose to the blood. So there's always this, this, does it make sense, Kaneli? That there's always this basically, I wouldn't say competition, it's more like a synergy between insulin and glucagon. So if you have your homeostasis low and there might be not enough blood sugar available, then the alpha cells secreting into the small intestine can give through glucagon can give the signal to the liver to break down glycogen, and that gets released in the glucose to the blood cells. So the blood glucose level rises to the set point, and the stimulus for the glucagon release is diminished. So it's like a constant, adjustment, which is really, why it's so important what you eat and how much is the, the sugar content, and what time do I eat it, and how frequently do I eat it. I mean, this is like constantly, measured and balanced out. And that's when, if somebody has a fasting sugar of 110 milligrams per 100 ml, which is considered the upper level of normal, for the body is definitely, already on high producing of insulin. So I think it's quite important to see the synergy between the alpha and the beta cells of pancreas.
And I love this awareness here of, like, everybody thinks blood sugar, pancreas, right? But it's always pancreas and liver and intestine. There's all this synergy. And so if your liver is in a really bad state, you're going to get a lot of these symptoms. And I remember a while back, one of the ladies asked, she's like, I keep getting this like nausea before my period. And this is like, you feel dizzy and like you need to eat, but you don't know if you eat, then it kind of goes away, and then, but it starts again, this like nauseic feeling. So that's often that the liver and the pancreas. I mean, it's great awareness just to understand. That's why everybody always asks us, why is it so important to do a liver detox?
Definitely you want the neighbors, the gallbladder, the pancreas, the small intestine, and the liver they need to be in great harmony with each other so that all these processes can work along. Imagine if you eat your cinnamon bun, or you eat your, ice cream, or your, I don't know why I'm always with a cinnamon bun, but that what it does, what alarm signals, and we need to secrete, that there's this implosion of signals that are really happen to the beta cells of the pancreas, because this huge influx of insulin. So that's what's happening. And we'll look at the next slide to really see what happens when there's insulin resistance. And I would like everybody really in the chat, even if you see the replay, or if you look at it later, whatever, I mean, is this something that you have been aware? Is this something that you have been exposed to? How much has insulin resistance, created your, or reached your awareness, which is very important, really, because it's something that, we don't really, I mean, insulin, okay, sugar, diabetes, this is really what we know. And here we are already with one leg in the full-blown pathology, but what is insulin resistance? So I would love to hear from you, how many of you have been really, exposed to this concept of insulin resistance. And what happens is, when you have insulin resistance, when cells in your muscles, in your fat, and in your liver, they don't respond well to insulin, or they don't respond at all to insulin, and they can't utilize the glucose from your blood for energy. So you have obviously a problem, for the insulin to lock onto the receptors that we've seen earlier. And as a result, your pancreas makes more insulin and more insulin. And over time, your blood sugar levels, they rise and rise and rise. And, your insulin is just not capable anymore to really respond to the energy usage of what is needed. So that is what insulin resistance is about. So it's a frightful trial. And the possible following problems for you, it's not just that your waist is definitely not what you would like it to look like, but the possible following health hazards is high blood pressure, high cholesterol, and type 2 diabetes. I mean, in the US currently it affects 1 in 3 people, and it's also it all gets framed into a syndrome which is called metabolic syndrome. So this all goes into into the pathology of insulin resistance. So if you have high blood pressure, high cholesterol, and type 2 diabetes, you get qualified for metabolic syndrome. And that means really that you've been pushing your body for so long that at some stage there's no way of return. And this is really why we're here tonight, so that we can really make sure that you might understand some of your problems or some of your symptoms that you might have experienced, that you might be able to address it and take it to your healthcare provider, book a Skype with me or Canelli, and really sort it out, that you really before you cross the red line, that you reverse this, because it is reversible if you do the right thing. So we don't want to get there. Metabolic syndrome is a big no. And I think the reason that you're actually listening to this is that you don't want to get there. So that's already a perfect first step. And awareness is, the most important step in this to take. So if you do understand where it comes from and what it actually triggers, then you're actually in a much better place. What causes insulin resistance and what are the risks? I mean, Obesity, and especially, the belly fat is definitely a very high risk factor in order to develop insulin resistance. So it's not really only that we don't like our waist looks, but it really, becomes into this pathology, the sedentary lifestyle, that we only sit and we go to the restaurant, we go to work and drive to work, and we then go onto our sofas and watch Netflix and series and exercise, and these things are something that is unknown to us. So really inactive lifestyle with no body action and body exercise, very important. Diet high in carbohydrates is very sort of leading up to insulin resistance. Gestational diabetes, so if you ladies in pregnancy, you had gestational diabetes, it's better, a good idea to look out and see and have some tests done to see if there's any remnants or any kind of stepping stones that there might be pushed there. Fatty liver and polycystic ovarian syndrome is very often associated with insulin resistance, which, especially the polycystic ovarian syndrome really affects also young people. So don't brush this away as, this is something that only happens to women in menopause. No, no, no. It's really something that happens to you at any age, and unfortunately younger and younger. So be aware and really make sure you connect the dots here. If you have a family history of diabetes, and if your mom, your father, your grandparents, your uncles and aunties have been, diagnosed with diabetes, so you better be on the watch out. If you're smoking, unfortunately, there's some ethnic ancestry with African, Latino, and Native Americans that they're more prone. So one needs to, have some alert bells ring there. It's more likely to happen to you if you're 45 years old and after. But as I said, especially with a polycystic and inactive lifestyle and obesity in young age, I mean, it's shocking how many people I see, they are really obese, and not morbidly obese that you would think of surgeries, but definitely too chubby. And this is already a big one. Hormonal disorders, if you have irregular cycles, or if you have fibroids, or if you have you know irregular periods, and thyroid issues and cortisol issues, this makes it very, very much more likely that you're going to run to this. If you're on medications like steroids, SSRIs, antidepressants, are make you much more prone to insulin resistance. And a big one is also sleep issues. If you do not put your boundaries out there for proper sleep, and you make sure that you really go to sleep in a range that is really regenerative and rejuvenating for you, it it really makes a difference. Obviously, also sleep apnea, which is something that happens to many more people than we think. Sleep apnea is really something that you stop breathing while you're sleeping, and you wake up in a state of panic, not only mentally but also physically. So you have this sudden surge of cortisol from the stress of waking up in fear, and that also affects, of course, your glucose level. So make sure that you are professionally looked after with your sleep. And if you do have sleep issues, have a sleep study done. You usually have to sleep one night in a sleep lab, and you'll be monitored and carefully assessed if there's any issues. And if there is, then there's help that can be given to you. So definitely don't ignore like chronic bad sleep as something that is just in your mind. This is really definitely also a big lead up for insulin resistance and many other things. So as you can see, I mean, the list is still much longer, but we cannot really go into all the details. But these are things that are happening to everyone, right, Canelli? I mean, smoking, history of diabetes in the family, diet high in carbohydrates. Hello, this is so many people that just, doing it. So
Yeah, I mean, what we also see is, if you go through big patches of stress or trauma, if there's some kind of trauma that's ignited, stress has become a huge problem, which, has issues with insulin as well. So, like shock, anything that's kind of shock related. So it has such a big impact. You don't know it's there. And what I wanted to ask you, Dr. Sabine, is, sometimes when people go to, to their doctors, they might not even pick it up because the levels seem to be normal, right? Even 210, sometimes they go, oh, well, you're in the range. So it's never really addressed.
Because I think it's also, how medicine has taught us, if you're within the normal range, whoever decides what's the normal range, then, you're okay. If you're creeping up from 90, 95, 100, 105, 110, 115, the path has been painted, for years and years. And I'm definitely not very popular when I point out, that I'm not happy with a fasting sugar of 105, because nobody really wants to look into, into difficulties. But, the truth is out there. And, that's why I'm always so, persistent on the reading of your blood tests in a regenerative way, in a preventative way. We don't really only want to address problems. We don't want to wait until the blood sugar is 120 or 150 and you need to start your metformin or your insulin. We would like to take, the little sign that your body gives you and really address it earlier. So why not? I mean, why to wait to run into problems? So I don't know.
And we see so many women out there struggling with all of these really bad symptoms, like really, and it's painful, it's debilitating. And then I say it's just wonderful that you can find a doctor like yourself that goes, hey, that isn't good. That's contributing to all this. And certainly it's not that known, or at least not practiced, that, you've got to actually have a sensitivity to these levels, because it's not okay, So thank you for, for sharing that with us, because that's the difference between struggling for the next 5 years with symptoms that bring you down and bring your whole family down and your whole community down, to actually resolving it and actually healing and freeing yourself from all this pain.
Yeah, because, we will see also on, on how you make the diagnosis of insulin resistance. How do I know, or how do you know if I have insulin resistance? It's really something that, it's a combination of everything. You don't always feel the effects of insulin resistance, so a blood test is required. Sometimes you do feel the symptoms, and we're going to discuss also these symptoms. So if you have an expanding waistline, so if you do measure your hip circumference and your waist circumference, and see that you have like an expanding waistline, this is definitely alarming. If your blood pressure starts creeping up and you have 130 over 80, which is okay, sometimes even higher, 85, 90, 145, 150, fasting glucose over 100, as we said, with the fasting triglycerides level over 150. Very, very significant. And ladies, it's to pay a lot of attention, as if you have a low HDL. So if the good cholesterol, the HDL, is under 50 milligrams per deciliters, it's really very, very much of a hint that you're going into this direction. So that's why, the cholesterol is not only exclusively information about the cholesterol, but it also gives us, an indication of how the neighboring organs are working. And remember the first slide that we had, this whole very tight neighborhood of gallbladder, liver, pancreas, and all these organs a little closed up. If I see that my HDL is low, definitely the cholesterol is going to be affected. This is a big hint, a big red flag for the fact that you're riding towards insulin resistance. So pick up the signs early. Make sure that you pay attention. Make sure that you pick a doctor that does pay attention and not just brushes it off because it's within the normal range, so you're okay. There are hints early on, years on. Yeah, go back, Kaneli, to the small triggering, facts that we see. Another thing that you see a lot is skin tags. So, especially in the neck area. So you get patches of dark and velvety skin, which are called Acantha's nigerians. You also get them at the back of your, of your elbow. You get them on your knees. You get them, on the neckline, and they're like, blotchy dark patches with skin tags. So that is not something that you just go and you laser it away. You just say, oops, something is not metabolizing correctly. Something is happening there. And this is a very, a very clear indicator for insulin resistance creeping up in your direction. So you see, these are really signs that they're everywhere. I'm sure you can relate to these signs. So please take them serious and have it reversed and really be aware. So it's elevated blood sugar levels, dark skin patches, elevated pores and skin acne, PCOS, polycystic ovarian syndrome, hair loss in women. The women suddenly have, the hairline is going back, and they have a loss that every time they brush, they have like, buckets of hair that they see everywhere, and also swollen ankles. So the swollen ankles, that you don't really see the ankle anymore. It's like going down like a tree, and you don't really get the thinning around the ankle. So other signs of insulin resistance. So pick it up, ladies. Tests for insulin resistance is, a series of questions from your doctor, a physical exam with weight and blood pressure, and you measure the waist, and you measure your, your HDL, your cholesterol, your fasting plasma test for the glucose tolerance test. What is that? Is a test that you measure your fasting sugar, and then you get a defined amount of sugar, which is usually 90 milligrams. You drink it. It's quite disgusting. It's very sweet and blah. And then you see after 1 hour, 2 hours, and 3 hours, how actually the body metabolizes this given amount of sugar. And you can see, if the sugar remains high and doesn't get metabolized. And another one, which is also very good, is the HbA1c, not HA1c, HbA1c, which is, the long-term blood sugar measurements. So you can actually see, measuring the HbA1c, how the blood sugar has been over the last 2 months. So it's like an overview, to see how well or not well your blood sugar has behaved over the last 2 months. So this gives you kind of like a memory stick of how your blood sugar was. These are very simple tests that every lab can run, and you don't need to go to a mega super duper lab. You can do it in any lab in your area and just see where you are and run out these things. So the dangers of insulin resistance They are, they're linked to obesity, to heart disease, cancer, and can also cause your cells to be resistant to the effects of your hormones. So it's not only, the effect of the insulin, but it can really also really upset the the general receptors of hormones. So you get then a logging problem, an on-logging problem with loads of other hormones as well. So it's really something that you don't want around insulin resistance. Now, yes, Canelli, that's your field. What we don't only want to be miserable and state all the horrible things and take a little tissue and cry. No, we want to actually see what we can do in order to reduce insulin resistance and get rid of it eventually. So there are a lot of things that you can actually do. And obviously one is to have regular exercises. 30 minutes 3 to 4 times per week would be wonderful, and you don't need to become a marathon runner. And I also don't want you to over exercise, because I see a lot of women that they then kill themselves to the bone, and then they have other problems. So gentle exercise 3 to 4 times a week, up to your taste, that gives you a lifting experience. So if you actually exercise to such a degree that you do your exercise and afterwards you're so exhausted that you can hardly find your way home because you're just totally kaput, then you're not doing the right exercise, because you're doing actually the opposite. You will need too much cortisol in order to go through this endurance program, and that's really the opposite of what we want. Watch your portion sizes and really pay attention to satiety. I think we all eat much too much. I mean, that's been around for decades, that one of the most amazing anti-aging or regenerative aspect in medicine is that we overeat. So we just need to calorie reduction, and don't have your plate being overloaded. Listen to your feeling of hunger. Do I really want to eat? Do I need more? Do I really want more? Do I just want the company? Is it social eating because I don't want to be lonely? I mean, pay attention. You don't need to stuff yourself. Really, satiety. Is that the right way to pronounce it, Canelli? Satiety?
Yeah, absolutely. And that's such a good word, because it brings us into awareness of putting the attention back onto yourself. Like, am I full? Am I, I'm full. Why am I still eating? Is it just of habit, or because I'm finishing everything on my plate? Otherwise, my perfectionism can't tolerate the food on the plate. Like, you always taught from a kid, finish everything. So it's really about coming back, putting the awareness on self. And I think as women, this is the big part of that we forget, that we need to put the attention back on self. And often I find insulin resistance is because the attention is out there. You're always out there. You're running around for everybody else. And then before you know it, even if it's 5 kilos, 5 kilos can bring on insulin resistance. So there are little hacks that you can add. So you start adding cinnamon. Cinnamon is a really good herb, so you can sprinkle it in the morning onto your fruit, onto your apples. Avoiding all forms of sugar. Now, something that I wanted to ask you, Dr. Sabine, because over the last years we've seen a lot of science come out, and they were saying that even a lot of diabetes patients, there's always this myth, let's say, like avoiding fruit. And we see now, if you increase your fruits and vegetables, increase your fiber, which I think is on the next slide. And what they're seeing is, that connection between the cholesterol and the insulin, like you're saying before, in the liver. And we're saying that if you're piling up on animal products, it's not going to help your cholesterol levels. So make sure that you put a lot of, look at that slide with all the amazing color, all this color will bring down your insulin resistance.
Yeah. I mean, my big one is really the intermittent fasting. That's really, we could talk for another hour about that, but this is really, it's really only the only way that you can actually convince your body to actually go into fat burning. Because if you constantly, give sugar, carbohydrates, meat and all of that to your body, there's no way that, insulin is going to come down, and, you're going to go into the state of glucogen, and breaking up some fat in the liver. So this is really something that is so rewarding. And I'm almost practicing it every day. I mean, during the week for sure, and sometimes many weekends, also on the weekends, depending if I'm going to be sociable or not. And it's also very flexible. I mean, it shouldn't become a stress that you cannot do it because I have this in that hour. But intermittent fasting is really that you give yourself this window, ideally of 16 hours, where you don't eat. So that means, you give your gut space to relax and to rejuvenate. You give your pancreas extreme, relaxing time, and regenerating, and all the rest. So it's amazing what that does to you, and how it also affects your cholesterol, your HDL, your HbA1c, your glucose tolerance, big thing. And avoid sedentary behavior, like we said earlier. You need to move, you need to really be in an active state physically, so without stressing yourself. And stay away obviously from refined carbohydrates like pasta, breads, flour, white flour especially, and up your fiber. So if you go 80% fruits and vegetables, and you add very good sources of protein, you're basically done. And you practice intermittent fasting, which is easy. I mean, you don't need to go 16 hours with a hello. You can just go 10, and then you go 11, 12, 13, and you up it, as you go along. Nothing should be forceful. And I think, that's also the recipe, right? Be good to yourself, nurture yourself, drink green tea, give yourself, a break from this coffee. There's nothing really good about coffee, really, other than, this nice little feeling of the smell, which kind of addicts you. But drink green tea, apple cider vinegar drink with warm water. It's also great, extremely good. Fatty fish, and lose the belly fat. I mean, this is really, these are big ones. So, I'm not saying with the good morning you're going to do all 12, but just put yourself little targets, have little goals out there that you want to make a difference for your metabolism. You want to really try and go this route of being healthier. And that's why we're here, right, Kareli? We're trying to encourage and motivate, and have you guys, with the right information, with the right hints and do's and don'ts, so that you can really help yourself to be in the driver's seat of your health. This is the worst thing, to snack in between. I mean, just imagine this beautiful little pancreas, what snacking does to them. I mean, they have like constant alarm situation in their little beta cells. Again, the insulin needs to be secreted, and again, for every nut, for every seed, for every chip, for every steak, for everything. This is all about constantly keeping the pancreas busy, and it's not fair on the pancreas. So so if you want him to be in good shape and looking after your energy levels on a long-term way, you better treat him nicely. And if you have chronic fatigue and you're always tired, think about your pancreas as well. Insulin resistance gives you also chronic tiredness. So you always feel tired, you always have no energy. So anyway, I think we've said it all. I think we've said it all, and I love sharing this with you. Thank you, Kaneli, as always. And I hope that the take-home messages is that we can do something about it, and we can be proactive about it. And I think that's what is also so for rewarding for me as a doctor, that if I see my patients really healing at the root of the problem, then that means I've done my job. And what we do here is really helping you to educate and to be more wise and more informed and make your informed choices, because that's what it's about. Good night from me. I'm going
Good
to have
night,
a
ladies.